I had multiple Division One scholarship offers. I was in magazines. You know, I had a lot going for me. I was doing very well in school. I was a very good student. And when that happened, when the injury happened, you know, all that was pretty much gone. I guess is the best word for it. The fact that I couldn't play again, you know, I had a mental breakdown. Pretty much is the best way to put it. You know, I gave up on a lot of things. I was I guess the best way to put it is I was almost, I guess, still shocked. I was disappointed. I was depressed. I couldn't, you know, do what I loved more than anything in the world. I met Ruotolo, and you know, that's when I was told that he confidently looked me in the face and told me, "I'll fix your shoulder, and you know, you'll be back to normal." And that was really the first person that ever told me that. So.
Danny had come into my office 7 years out after his first initial shoulder injury. And he had injured his shoulder when he was 18, playing football. He had dislocated it. And after that, he had a surgery, of which his surgery failed. He had dislocated a couple more times after that. He had a repeat surgery, of which that failed again. And at the time when I had seen him, he said that his shoulder dislocated constantly. And it was a big problem for him. He had given up most sports. And he was pretty much resigned that his shoulder was just miserable, and if you put it in the wrong position, his shoulder would pop out, much less whether he'd ever play another sport again. And he was also at the point in his life where he couldn't play any sports, even though he was a great athlete beforehand. On examining Danny, he realized, you know, he definitely had a very unstable shoulder. His shoulder was dislocating out the front. But on looking at his studies, the reason why he had this problem was that he had bone loss. And bone loss is an uncommon problem after shoulder instability, where you get a dent in the back of your humeral head, and you get a dent in the front of your socket, and then from there your shoulder repetitively comes out because the socket's half the size that it's supposed to be. So if you bring your arm up into the wrong position, you get a little bit past where that dent is, your shoulder's just going to, you know, pop right out. That's also something that you shouldn't have an arthroscopic soft tissue procedure for. Is one of the few reasons why an arthroscopic soft tissue procedure will definitely fail. Is you can't make soft tissue make up for bone loss, and so that is something that needs to be treated with an open procedure. It is one of the few reasons why I might open a shoulder. The vast majority of my shoulder surgeries are always arthroscopic. But you have to be able to identify this. And it was sad in the sense that Danny's surgeon either missed this or disregarded it, and he had multiple surgeries and was still very unhappy and still had a major problem. We went through the procedure, which was an outpatient procedure, and he did very well with that. And I'm very happy that he's had success and that he has a new shoulder again.
Previous to Ruotolo surgery, I had, you know, that window where I couldn't really do anything at all. No matter what I was doing, my shoulder was coming out of the socket. I couldn't do anything. The repair, I guess, you know, didn't work, whatever. And I couldn't do much with my friends. I couldn't do any really recreational activities, things like that. I couldn't do any pickup games, any sports. And since Ruotolo, I've been able to do that again, you know, which was one of the best things about it, obviously.
So Total Orthopedics and Sports Medicine truly has a comprehensive team approach to the care of the athlete, and that's because we're all subspecialists. We're all fellowship trained in our different fields, which include sports medicine, shoulder surgery, and hand surgery and spine surgery. We have a primary care sports medicine doctor who can also deal with all the medical issues that comes up with the athlete, and we have a true comprehensive evaluation treatment for anyone who comes through our doors.